Hi, I'm Elizabeth Hess, and I am here today with Julie Pryde. She's the administrator of the Champaign-Public Health District. Hi, Julie.
Hi, how are you?
I'm doing okay, considering. My first question to you is, welcome to phase 4. Now that we're in phase 4, not a lot is going to change for my family and me. I'm not going to lie to you, but what is there to do that is safer now that we're in this new phase?
Nothing. Nothing is safer to do now than it was in any other phase. Things are opening up, but that does not mean that people can stop the mask wearing and the social distancing. You still need to remain with your cohort, meaning your household most of the time. I just keep telling people just because things are opening up does not mean that that is safer. So everyone needs to assess the situation they're going into and their own, tolerance for risk. But again, a lot of things that you do outside are safer. All the outdoor recreations, open. If you have your kids at something, make sure you take hand sanitizer or wash their hands when they're done and keep an eye on them. And also, if you're going to something, just because it's open, if they're not following guidance and their employees aren't masked and people are crowded around and they're not doing things, get out of there. Don't put yourself at risk. So get out of there, call the manager, and let them know that that's unacceptable. And then you can call public health after that if you like.
Indoor seating is now at 50% capacity. We have 2 states on decline. Illinois is not one of them. We're holding steady.
Mm-hmm.
If we see the numbers reverse and start to rise again, is there a chance that we will have to take a phase back?
Absolutely. That is certainly a possibility. Everything is based upon, the numbers and the hospital capacity, things like that. Illinois is still doing pretty well. We have, we're not declining yet. I hope that we do start declining, but I think people need to adjust to, level 4 right now, phase 4, and not act like it's a free for all. And certainly younger people are acting like it's a free for all. That's nationwide. And that they just have to understand that the more outbreaks that are caused, the more hospitalizations that are going to be caused, the more potential deaths. And it is likely that just like Texas and Florida and other places are finding out, if you do not do what you need to do during a pandemic of this type, you're going to have to end up shutting things back down. We would like to prevent that. Certainly, I think the restaurants with the 50% capacity, they can do that. They can do that safely. People need to be respectful and wear their masks when they come in, when they leave, and when they get up if they need to use the restroom. If the waitress is at the table, I keep my mask on, even when I'm in an outdoor restaurant, because every time you're not wearing a mask around one of their employees, you're putting them at risk.
You mentioned younger people, so we're talking about 21 to 31, in that range. They're hitting the bars more, and the rate of infection is increasing, but their death rates are lower. So why is this such a dangerous population in order to get the virus and spread the virus so easily?
So younger people, they're in general more risk averse, if you will. They are not risk averse. So they basically, a lot of younger people kind of feel like they're invincible. That happens. We deal with that in public health all the time. Parents deal with that with their kids all the time. But while they may not have a serious case, there are absolutely serious cases and deaths in young people. They are happening. They're happening not just in the United States, they're happening all over the world. And you can look at the Chicago numbers all the time and you see people in their 20s and 30s dying from this and younger. So it is literally like every time you do something and you're younger, you're taking a risk. Am I going to be one that that has a bad outcome or doesn't? The other thing that's so concerning about young people is that they go out to, whether it's the bars or parties or whatever, and then they go back to their houses. If they're living with family members, they're going to infect them. If they're living with roommates, they're going to infect them because it's very infectious within households. And then they're going to go back to their jobs or their classes or whatever, as are the other people that they've likely infected in their house. They are going to go back to their jobs. So with every secondary and tertiary infection, you risk more and more people. And you don't know where that's going to land. You don't know if that's going to end up hospitalizing or killing somebody. You just don't know. So just because they feel more invincible certainly does not absolve them of their responsibility. They need to continue doing what they're doing, and bar owners and people who plan parties need to also be very aware of their role in this and helping to stop the infection, because nobody wants to go back to a lockdown type of situation. But it's happening in other places, and I would think places would be taking heed from that. You can look around at all these states and see it did not work, and it's not going to work. And anybody who with any common sense would have realized that's not going to work. You cannot put people inside a building without masks and social distancing for any reason during a pandemic without risking spread, any reason.
My next question is complex, and we could spend an hour on it. But according to the CDC, 33% of hospitalized patients with COVID are Black, even though they make up just 18% of the community that they were analyzing. I know this is difficult to answer. Why are there such racial disparities among African American communities with this virus?
There are racial disparities with COVID, just like there are with everything else. So, in public health, and I'm sure other places use this little analogy, but let's say that you have a lake in front of your house, and you come out one morning and you find that one fish is floating dead in that lake, right? What is your first thought? Your first thought is, ooh, I wonder what happened to that fish. Something must be wrong with that fish, right? You would think something happened to kill that fish. If you then come out like the next day and half of the fish are floating up, you start to think, oh, maybe it wasn't that fish. That fish didn't have a problem. Maybe there's something wrong with my lake. Maybe my lake has been poisoned, or maybe there's something wrong. I better analyze what's going on with my lake. Then let's say the week after that, you come out and you find out that all of the lakes around your entire community, and in fact, the entire United States, have fish floating dead in them all over the place. Then you start thinking, that's probably not just that little section. That's not just that community, or that's not just that healthcare. What is the deal there? You would start analyzing the groundwater. Well, the groundwater that's poisoning our communities and causing all of these disparities is called structural racism. So I said at the beginning, that COVID-19 and will, like any pandemic, is going to change society. What it's doing is shining a very bright light for everyone to see what these inequities are in social determinants of health, specifically, economic stability, education, healthcare. So when you have inequities in all these areas, let's just take economic stability. Who are the people that were doing who were the quote unquote essential workers? Well, a lot of those were people who were making less money. They were in jobs without health care. They were in jobs without benefits such as paid sick leave. So people were being forced out there early on in this pandemic to do jobs that we considered essential. So that would be grocery stores and lower wage jobs. Certainly the meat processing plants all across the country, we saw those, people working in long-term care facility. And if you look at a lot of these jobs, the vast majority are people of color. Not all, certainly, but a lot. So right there, it's shining a light on, that problem. You look at education during the pandemic. Who is falling behind during that? That's people, low-income people, often of color, who are in neighborhoods they're in neighborhoods without access to access to computers, without access to internet, all those type of things. That also is structural racism that causes these type of policies. And then, of course, healthcare in general. Again, if you have a job without health insurance, you're not going to be going to the doctor all the time. So what we're seeing across this country in people who are having the most negative outcomes, these are people who likely have some sort of undiagnosed, unknown, underlying health condition, whether it is hypertension that they don't know about because they don't go to the doctor, possibly diabetes, possibly, kidney problems, all kinds of things. And so it's not that there's something biologically different about people of color that's causing all of these health disparities, especially around COVID and the excess deaths. It's actually all the things surrounding them that lead up to that. So that's why we are really trying to get across to people that we have two pandemics going on right now, or not pandemics, epidemics, two public health crises that are converging at the same time, and that is structural racism and COVID-19. And everything plays together. So we have got to address both at the same time.
Public health inequities are nothing new to public health. This is something you've been planning for, but it's now on everybody's radar. Do you see us emerging from this pandemic with a better handle on that kind of systemic racism?
I do. I mean, again, sometimes, people tease me that I'm the public health Pollyanna, but yes, I actually do think that we could come out of this a much better place. There are many things converging at the same time that could never have been planned. It just happened. And there are people now who are seeing, you can't miss it. They're seeing the inequities. Sometimes you just don't see them. People live in their own little worlds and they don't see them. Of course, public health, we see them all the time. But I think now people are really starting to understand, wow, why is my employment tied to my health, or my health care tied to my employment? How is that fair to people? How is it that I live in an area that is, I have to live in overcrowded housing and, things like that. And then I risk infecting my entire family. There's just so many things. Why is my employer not caring about my health by putting in things that will protect me? So I think people are starting to see it, and you have to see it before you can change it, right? So in that sense, just like with HIV/AIDS, that pandemic, it really changed society a lot. And I don't think at the beginning people understood that was going to happen, but that did come out of it. And historically, that always happens. So I have said since the beginning, I hope we come out of this a more just society. And I really do believe we will.
Coming out of the physical part of this public health crisis, that's something we can focus on with contact tracing and testing. Testing still happening out at the mall. Antibody testing now seems to be ramping up and taking more of the focus on how do we get herd immunity. What exactly is antibody testing, and do we want antibodies for this in our bodies?
Okay, well, antibody testing pretty much just assuming that it's good antibody testing that's, valid, not like some of the really crappy instant tests that they have out there. But you need antibody test would show you if you have been infected with COVID-19 or the virus that causes COVID-19. Normally, that's a good thing to know because it usually means that you are then immune and that you can then, possibly alter your behavior, or it helps public health to alter certain things, policies or things like that. The problem right now is we do not know still what antibodies to COVID-19 means. We do not know if it means that you now have immunity and that you cannot get reinfected. We don't know that. So therefore, it's not really that useful of a tool. They are using a lot of different seroprevalence studies to see maybe, who's been infected to get a sense of how many people may have been infected without testing. And early on, that was really important because there was hardly any testing. So we know that there were lots and lots of people. The current stats that I've seen say around 10% more, or I'm sorry, 10 times more people have been infected with COVID-19 than actually tested positive for COVID-19. So they probably were early infection, or they just didn't go to get tested. So what does that mean? Well, that tells you that there's been a lot more infections, which is, not necessarily a good or bad thing, but what we do know is that there have still been, even with 10 times more people, there have been almost 125,000 deaths from this in just this many months. So if we have to get to herd immunity through infection rather than vaccination, which some people argue for, that's absolutely unacceptable, because we're talking at a minimum probably around 1.5 million deaths from this in the US. And that is if infection confers immunity. Otherwise, it would just be, 1.5 million deaths that were essentially meaningless because people would still be able to keep getting infected. So antibody testing is out there. It's not very useful right now at all. But there, eventually we'll know what that means and then we can start using it. But the key thing is you have got to just continue to practice being 6 feet apart from people and wearing the masks and doing those type of things, because otherwise you're literally, every time you don't do that, you're risking a potential infection, and it may be one where you just get sick and get over it, and it may not be.
You bring up a good point. Coroners have to put a reason for death on the death certificate. If somebody is obese or has heart disease or diabetes, but then when they die, they have contracted COVID-19, is that death getting counted as diabetes, or is that a COVID-related death?
So on death certificates, it has, multiple things, contributing factors, for example. So you can have, cancer and still die of COVID. So, and a lot of times if you have something, hypertension or obesity or diabetes, COVID is exacerbating the problems and greatly speeding up your death, basically. So yeah, there's so much, people want to argue so much about, well, this isn't really a COVID death, they're just making up numbers. Well, no, that's not true. That's not how any of that works. One need only look at a death certificate in Illinois to see how, things are listed. There are all kinds of things on a death certificate that people don't realize, but it's not like they just take every death certificate and stamp it COVID and move on. I mean, so there are people who could be terminally ill, but COVID speeds up their death because they've gotten really sick from that. So
it's not either or, it could be.
It's not either or. There's multiple things listed on a death certificate.
Okay, a lot of my friends are heading out of town. They're doing road trips, they're doing flights, they're going to wear masks, they've got their Purell. Is there a safe way to travel out of town right now?
Well, I mean, yeah. I mean, you could, if you wanted to go somewhere and you're in your car, people ask me all the time, what about gas stations? Well, going into a gas station, you're in there for a brief time. You touch your, if you put gas in your car and you go in to use the bathroom and you grab some snacks or whatever, that's fine. Wear your mask. Don't get around anybody. If they're crowding, pick another gas station or just wait until they leave, and wash your hands. And, in my car, I have some wipes that are now 75% alcohol, so you can really, rub down your hands. I actually bought those at a gas station. Thought that was interesting. But, just basically wash your hands, wear your mask, do the same thing you would do. Now, can you go somewhere and then get in a crowd? No. Can you go to Chicago and hang out in a park just the same as you could in a park around here and stay away from people? Yes. I mean, there's things you can do, but you can't, there's no magical protection just because you're on vacation. And we know that that happens with all sorts of public health issues. Vegas comes to mind. So, just because you're on vacation doesn't mean that you don't have to practice the same infection control strategies that you're practicing at home. With the airplanes, that's a whole nother issue. They were doing airplanes where they were having some social distancing in there. Everyone was wearing masks. If people do that, it definitely makes it safer. But to ride on a packed airplane would be even, I mean, I wouldn't, But to ride on a packed airplane is even less concerning to me than standing in the TSA lines for a very long time, which I've had to do with people, they're right up on top of you. So there are a lot of choke points, if you will, in a trip through an airport that could be increase your risk a lot.
Recently, and I don't mean to single out one area town, but the unofficial Mohammed prom, because of that, we've had cases increase exponentially in that town. They all say they signed waivers. How does CUPHD get involved once these cases start to multiply?
Well, for every positive case we get, we do contact tracing. So we try to find out where individuals have been during their infectious period. And it's super important that people be honest with us and forthcoming with information so that everyone can have the opportunity to, first of all, know that they were exposed and get tested, but also part of the public health role is to put people in quarantine who have been exposed so that they don't get infected and then go out to their jobs and infect more people and then start, then they go home to their families and it just keeps going and going and going. So yeah, there's always a concern of any type of indoor event, especially without masking. During this time with this much community transmission, you're pretty much asking for an outbreak anytime you do anything like that.
Last question before I let you go. 23 people have been hospitalized. 206 have lab confirmed infections after eating bagged salad, according to the CDC. Public health has not forgotten about foodborne illnesses. Is this something that you're also educating people to stay safe now that people are having picnics?
Yep. Well, they're getting sick from cyclospora, which is sort of unusual, but not unheard of. But yes, so we are still getting reports of things transmitted through food. We're still getting, we're still going to have mosquito-borne infections. We're still going to have other vaccine-preventable diseases, unfortunately, and we're still going to have all kinds of possibly unusual cases pop up. We've had tularemia pop up in the summer and fall here a lot. So we are absolutely still on top of all of the other reportable diseases. You don't get to just focus on one. That's what most people are hearing about. But certainly if you go into the doctor or hospital with something and it's a reportable disease, we follow up and contact trace it just the same as we do, COVID. So we are following up on all that. And we knew, of course, at the beginning of this that we're still going to see all kinds of other illnesses pop up. So we are still doing those jobs as well.
Thank you for doing that. I also want to thank Urbana Mayor Diane Marlin for letting us do this. Jason Liggett, thank you for producing us for UPTV, and Julie Pryde, Administrator of the Champaign-Urbana Public Health District. What would we do without you? Thank you so much for all of this information.